Okay, it is July 11th, so it's been like 2 months and a week since my surgery. So I figured it was about time to do another video because I haven't done one in a while because there hasn't been much to talk about other than things are healing and stuff. So I'm in my bathroom because I'm kind of doing, this isn't the official after shots, but you can see kind of what's been going on here. I'm pretty happy with it, to be honest. I have the majority of my range of motion. Once I get up to around here, it gets a little bit iffy. You can see the skin there being pulled. My plastic surgeon says that that's going to, over time, not be so tight. And with enough stretching, like basically when I'm out walking and stuff, I do various arm stretches, and after a few it becomes much easier to raise my arms, so it kind of needs just a bit of a warm-up, if you will. So I just do that fairly frequently. And so yeah, you can see the underarm incisions, and then along here these are lightening up over time. I can easily put the silicone products that I have to diminish scarring on these incisions. It's a bit tougher to get under the arms because obviously I'm wearing deodorant under my arms now because I can, yes. So it's so they don't get as much scar reduction treatment yet, but I figure I'll just always have the scar reduction stuff on at night, while on my arms I can have it on all the time. But I mean, as you can see, none of that hang down is there anymore, so I'm pretty excited. Most of the rippling kind of look is gone. It looks a little bit worse on screen than it actually looks in person, but so I'm pretty happy with it, to be honest. And then so I've been having it up here so you can just see the scar, but basically, as you can see, it's not at all visible at all if I have my arms down as I normally do, and even if I were walking, you might see a little bit right there, but not much, so, because I walk like this. But so it's been really great. As far as what I'm able to do and not do, like I said, I mentioned I just need to stretch a little bit and then I can get my full range of motion in my arms pretty well. My plastic surgeon who I saw last week said, don't be doing pull-ups that have your arms all the way up and, bearing weight on them and stuff. But other than that, I'm pretty much good to go. A few of my videos have talked about basically how it was difficult for me to deal with kind of the weight gain that I gained over recovery, and that was tough. But I've lost, so I ended up, I think my highest weight, so when they weighed me before surgery to make sure that I had, all the right dosage for the medication for my size, I think I was 121 pounds. That was before tissue was removed. Obviously I wasn't weighed immediately afterwards because there was no point and there was so much swelling, but the highest I got after the surgery over the course of my recovery was 132 pounds. And I mean, when you consider that I had some liposuction done, some skin removed, and I lost some muscle mass, it actually comes out to me having gained about 12 to 13 pounds of fat. In my estimations. That's not like I sat down and did the math. It's estimated, but still, it's that's pretty significant, especially, I mean, that's 10% of my body weight. So I definitely gained weight in a bad way, but luckily, like I said, I got it to 132. As of today, I am at 124.3, so I'm back to cutting my weight back down again, which I'm excited because yeah, I've got my nice arms, but none of my clothes fit, so I gotta get back down again, which has been going really well. I did end up dropping my organic chemistry course, which I talked about because I didn't feel able to do it with my arms. I mean, because there was also a lab, and I would have had a lab partner and had to have them do all the work, and that wasn't fair to them. So I don't have much to do, honestly. So I said, well, this is a great opportunity to get my weight back to where it needs to be, and possibly even better than it was before. So So that's going really well. I basically walk all, like, I've been walking all day, every day. I'm a big Fitbit fan, by the way. And so I started, your default goal is 10,000 steps. And I'm like, I can move that up to 15,000. I've got plenty of time in my day. I can go for walks. And I'm like, 15,000. I'm not that far off from 20,000. And that's how I ended up getting 30,000 steps in one day, and my knees hurt. So, so I'm actually gone a little bit overboard on the walking, I think, just because I have all the time in the world to do it. But it's been going really well. So I just need to rest my knees a little bit more between walking, and maybe not push for 30K days, maybe stick with my 15K. But basically, bottom line is things are going great. My arms still feel weird, and I don't sleep very well because of it. It's not pain, it's just discomfort. And it's not extreme, it's just they feel weird. And I'm sure that either that's going to go away or I'm going to become accustomed to it, so that doesn't really bother me too much. So that's where we're at. My surgeon, basically, when I went to see him last week, he was like, yeah, don't do pull-ups, see you in 6 weeks. It was like a 2-minute meeting, really. So I'll do my official after video and after pictures and stuff in about 6 weeks, since that's when he's going to do his official after pictures and video and stuff. So thanks for watching.